Hello guys, today I will be discussing about the memory based questions of FMGE January session 2027 50 plus. So which substance is added during flocculation? Flocculation alum is added during flocculation. Temporal area trauma with symptoms of meaningless speech from the patient, with which area will be affected. So Wernicke's area is most likely to be affected. Now CFTR gene mutation affect which channels? So chloride channel is affected when CFTR gene mutation is there. Then cherry dot spots are seen in CRAO, that is central retinal artery occlusion. Total number of girl child born to women in according to mortality, that is NRR. NRR is net reproductive rate. Then surgical neck fracture of humerus leads to which nerve damage? So axillary nerve will be going and winding around the neck of the humerus. So axillary nerve will be the answer. Now sex with inanimate object after and getting sexual gratification from that is fetishism. That is the correct answer. Now male with lytics, expansile lesions and histopathology that shows numerous multinucleated giant cells, that is osteoclastoma is the correct answer, because multinucleated giant cells are mentioned and expansile lesions with lytics. So this is osteoclastoma. Now woman with 37-year-old pregnancy, iron and folic acid dose. So 60 mg iron with 500 mg folic acid dose is the correct answer. Now distance between gastroesophageal junction to the incisor teeth is 40 centimeter. This is the correct answer, one-liners. Now most controversial Pearl index, and most of you are confused and ask me what will be the correct Pearl index in this. So 500 women with 4 accidental pregnancies with 6 months of contraceptives use. So to first we have to take out calculate the total months. 500 into 6, that is 3000 months. Then that is 250 years, but that is not needed. Total number of pregnancy upon total months into 1200. So 4 into 1200 upon 3000, that is 1.6, and 1.6 is the correct answer for the Pearl index. Now rehab is which level of prevention? That is a tertiary level of prevention. Now image based question for corpus callosum was there, that is the correct answer, which joins two hemispheres. Cross section was there. Now crumble tissue appearance seen in Gaucher's disease, and one image based question, that was the image based, and crumble tissue appearance slide was given, so that is the correct answer, Gaucher's disease. Salt intake restriction is which level of prevention? So primary level of prevention is salt intake restriction. Now action of palmar interossei. Action of palmar interossei is abduction, and for dorsal interossei, that is adduction. Child with self-mutilating behavior, so that is due to which deficiency of which enzyme? That is HGPRT, the enzyme deficiency. Now alcoholic patient, just after taking which drug patient will be having abdominal bloating, discomfort, distension, and shortly after which drug? So this is disulfiram. This is the correct answer. Now accused co-worker with sodomy. So current sample, what sample is needed for confirmation? So seminal and blood samples from anus will be taken for confirmation. Now child with palpable purpura, arthralgia, arthritis. This is the very characteristic repeated question. HSP is the correct answer. Henoich skull and purpura is the correct answer. Image based question for anterior cruciate ligament was there. I will be adding that images later. Male derives sexual satisfaction with female cloth dressing, that is eonism, that is the correct answer for this. Now truck drivers with single painless genital ulcer lesions, that is secondary syphilis, that is the correct answer. Now image based question for psoas major and minor was marked, muscle was marked, so this is the correct answer. Gunshot lesion with abrasion, grease collar, and no sign of burning, then but tattooing is present. If tattooing is present, intermediate shot is there and burning is not there, so it is not a close shot. So range was asked. Tetralogy of Fallot, an X-ray was there in that common X-ray. You have seen that tetralogy of Fallot was the answer for that. Image-based question with the hepatosplenomegaly as symptoms of poor growth, neurological, poor coordination, slurred speech. These all were given. So that is Niemann Pick disease. Enzyme deficiency is Pompey's disease. That is acid maltase is the correct answer for this. Finasteride mechanism of action, that is 5-alpha reductase enzyme inhibitor. That is the correct answer. Fruit avoided in pregnancy in India. So unripe papaya, this is the correct answer. Why it is avoided? This is most commonly you have asked. Due to increased latex, and this causes increase in contractions. So that's why lots of pineapple and unripe papaya is avoided during pregnancy. Then one question regarding rashes after Mycobacterium tuberculosis. Can you recall the symptoms in my comments? I will be telling you the answers later on. Now, for image-based question with a coin in esophagus was given. That was the correct answer. Coin was there, nothing else. No fish bone and nothing. Coin was there. Now, ketoconazole inhibit which enzyme? So, CYP3A4 is the correct answer for this enzyme is inhibited by ketoconazole, and CYP means cytochrome P450 is the correct answer for this. Now, Osiander sign image-based questions were there, or that was Chadwick sign. I can recall all these, but can you tell me which sign was there, which image-based question was there? That will be very helpful for you for recalls. Now, Frey syndrome question was asked. Localized swelling, flushing, redness, itching, warmth. This is present in cheek, temple region, and that is triggered by the food. So this was also asked. Treatment for pterygium. So lubricating and anti-inflammatory like drops are given in mild cases, and eye drops are given, and surgical removal insignificant growths, that is the management for pterygium. That was the answer. Now, furosemide toxicity symptoms, that extreme thrust, muscle cramps, irregular heartbeat, sunken eyes, decreased urination, and ototoxicity. These were the options given. So these were the furosemide toxicity. Can you recall the options? Or I could not recall the options. Now, one renal physiology, bladder plasticity. Can you recall the question and the options? But this was asked, so can you recall it? Aorta opening point. So aorta opens at the base of the left ventricle. This was also very confusing, but base of the left ventricle is the correct answer. Now, Avgar score. Can you recall the question and options for me? Not getting the options and questions. And now, atypical depression. So sleeping for 15 hours. This is the correct answer for this. That is for atypical depression. Now, first wall of duodenum, which of artery is affected if any injury is there? So gastroduodenal artery is present at the first wall, first part of duodenum. That will be affected. Now, fortification. So vitamin A is added to the butter. This is the correct answer for fortification nowadays. One ranula transparent illuminant, brilliantly illuminant swelling. That image was asked. So answer was ranula. Now, treatment for deep burns and management is split thickness. Split thickness skin graft. Man 2 syndrome was asked, but you have not told Man 2A or Man 2B. Mostly Man 2B has been asked. So that is familial medullary thyroid carcinoma, pheochromocytoma, and mucosal neuroma, Marfanoid body types. These all are the options, and Marfanoid body types is seen in Man 2B. Man 2A, medullary thyroid carcinoma, pheochromocytoma, and primary hyperparathyroidism is seen. So which of the following was asked? Can you just confirm in the comments? Now, dose of morphine, 5 mg post anesthesia for bradycardia and tachypnea. This was the question asked. Can you recall more options? I will be including that. Marfan syndrome, so that is autosomal dominant and mutation of the fibrillin 1 gene on chromosome 15, that is for answer for Marfan syndrome. Now, knee joint inflammation. One question was regarding knee joint inflammation. Can you recall the options, please? So that will be helpful in recall. So around 50 plus questions I have recalled. Some questions and options are missing. So you can comment below. We can include in the next video. And other questions, if you can recall along with the options, it will be helpful for you only to recall the questions. Thank you and stay tuned. Other parts will be coming soon.